Hello, I'm Dr. Amy Bandy, plastic and reconstructive surgeon. I'm located in Newport Beach in Torrance, California. We have 2 offices. And today I'm here to talk to you a little bit about breast enhancement. Many women after childbirth or after weight loss or simply with the aging process find that their breasts no longer are quite as youthful or full as they were in the past. And they often come to me or other plastic surgeons looking to try to rejuvenate the look of their breasts. There are many options for women to try to rejuvenate the look of their breasts, but probably the most common is breast augmentation surgery. With breast augmentation surgery, a patient has the options of either saline or silicone implants. When I see a patient in my practice who's coming in for breast enhancement, I will take a very thorough, complete history and do a physical exam on the patient, and then we'll have a very in-depth conversation about her options. Women have the options of saline and silicone now for the past 3 years. However, prior to that it was only saline. But with the wonderful advent of the new cohesive gel implants and the Naturel implants by Allergan and the cohesive gel by Mentor, women do have that option of having the silicone implants, which in many instances can offer a more natural, a softer appearance than what the saline does. Women who are 22 and older are able to have their choice between the saline and the silicone, and women who are 21 and under, between 18 to 21, do still have the option for saline. However, they do not have the option for silicone. When I meet with a patient, I will first find out from them how much research they've done, whether or not they feel that they are looking just to enlarge their breasts, or if they're looking to change the shape, if they need to make their breasts more perky, if they're even or symmetric or not. So there are many factors in determining what is going to be the best surgery for the patient. And oftentimes simply breast enhancement with implants is all they need, but there are times when the patient needs an additional procedure. For example, if a patient has had children and has nursed her children, oftentimes the pigmented areola skin that surrounds the nipple area will enlarge and stretch, and the skin around the breast tissues will sometimes become loose and the nipple areola complex will fall. In those instances, it's better to combine the breast augmentation or enhancement with implant surgery with a mastopexy or a breast lift. Now, there are multiple procedures to do lifting of the breasts, and it really depends on each individual person which breast lift is going to give them the results they're looking for. A lot of it depends on the volume that they're starting with their own breast, the volume that they want their breasts to be in the end, and what we need to do to achieve that in between. Some women even have enough of their own breast tissue to simply have a breast lift and have a beautiful result without implants. However, there are still a majority of patients where breast enhancement with implants is what is going to give them the ideal look, because oftentimes they've lost breast fullness after having children and breastfeeding. We also see women whose breasts are just very, very large, and it is causing not only discomfort in the breast area, but in the shoulders and in the upper back, and they're coming in looking for relief of their painful symptoms, as well as a prettier, more enhanced, beautiful look to their breast. In this instance, I will do a combination of a breast reduction surgery, where we're actually removing some of the breast tissue, and a lift or mastopexy procedure to give them the ideal shape to their breast, size to their nipple areola, and a much more youthful breast. And then there are also situations where women need a partial reduction or full reduction and placement of implants, either in front or behind the muscle. So as you can see with this video, that there are so many options for women, and so much of it is really, really individualized that it's difficult to say that there's a set procedure for what your problem is. This is why we are offering complimentary consultations where you can come in and have an in-depth conversation with me. I will do a thorough physical exam and determine what it is you're starting with, get a very good feel for what it is, what your final endpoint is that you're looking for, and together we can make the choice of what's going to give you your ideal look. And again, thank you for visiting us today. We can be reached on the web at www.drbandy.com. Looking forward to seeing you.